My name is Dr. Judith Mkwaila. I am a consultant general surgeon from Malawi, Africa. I'm here at Krishna Institute of Medical Sciences, deemed to be a university, as a surgical oncology fellow under the Merck Foundation Oncology program. I am here since March 2022 and I'm expected to complete in February 2023. This is a one-year course that I started with. My journey to be a surgical oncology fellow under the Merck Foundation Oncology program starts way back, like maybe 3 years ago. I was searching over the internet because I grew to have a passion in surgical oncology care, even as a general surgeon. And I got some exposure by electives in the Edinburgh breast unit. This grew my passion for oncology. So I kept looking for an opportunity, and the most difficult part was to find finances to go and have a fellowship in surgical oncology. So I saw Merck Foundation sponsoring these oncology fellowships. Then through our Ministry of Health, an advert was issued, which we applied, and I was selected to join. And I was quite happy because this is a competitive opportunity where surgeons in the Africa region compete to find sponsorship under the Merck Foundation. Oncology care in Malawi is a subspecialty of medicine which is just upcoming. All over Africa, the training for oncology in all subspecialties in clinical oncology, be it surgical oncology, medical oncology, radio oncology, and even radiologists and pathologists is very scarce. Training programs have come up, but they're still in their development stages. Malawi is not spared in these whole problems. So our key challenges to oncology care in Malawi, they span from direct patient care problems, education and training, and research in oncology. So coming back to direct patient care challenges, issues stem, in Malawi, the level of care is in 3 levels. We have the primary health care, the secondary health care, and the tertiary health care level, where most of the onco cases are seen. But these patients will have to come from a community, then be transferred through that level of care system into the tertiary level care. Now, even in the tertiary level of care, we have huge shortages in terms of clinical specialists. As a country, currently we only have 2 medical oncologists and 2 radio oncologists on the ground. I think 3 radio oncologists on the ground. For surgery specifically, we do not have fellowship-trained surgical oncologists. So I'll be among the first cohort to train as a surgical oncologist back home. Now, looking back at the key challenges that Malawi has in terms of oncological care, you realize that human resource is a major, huge drawback in cancer access. So the Merck Foundation Oncology program is very, very important to train, to give us the workforce that we need in Africa, that we need in Malawi to take care of these patients. And on top of this human resource is diverse. So the program encompasses all the disciplines which deal with cancer care. Cancer care is not for doctors only, it's for nurses, physiotherapists, the lab. Everybody is involved in cancer care. So this is where Merck Foundation comes in. As you also recall, one of my major challenges to subspecialize was finances. So that's where Merck Foundation comes in to support these particular trainings. My main expectation as a general surgeon was to hone my skills in technical skills mainly, both in open access and minimal invasive surgeries in care of patients with solid tumors. So as a general surgeon, my focus is breast, gastrointestinal, which is upper GI, stomach, esophagus, colorectal, and also head and neck surgeries, with mild of urological surgeries, uro-oncology, because also we have few urologists in my country, and most of those cancers are done by genosurgeons. So coming here at KIMS under the Merck Foundation Oncology program, my expectation was I'll hone in both the technical skills, the science behind, to understand the tumor biology, to understand how the different modalities in cancer care, whether radio, medical, and even surgery, interact together for a better outcome for both local disease control and systemic control of disease. It has been 6 months of me at Krishna Institute of Medical Sciences under the Merck Foundation Surgical Oncology Fellowship program, and it has been an exciting journey. As a genosurgeon who has practiced for 7 years post-residency and have done quite a couple of most of the surgical oncological procedures, there's still some technical details that one has to learn to understand the local control of disease. So in my part in particular, I have really become so much confident in my lymph node dissections, which is a very key important part of local control of disease. So be it axillary dissection for breast cancers, be it neck dissections for oral cancers, pelvic dissections for urological or gynecological cancers, and also dissections, lymph node dissection for gastric and esophageal cancers. And actually, I have become more confident to dissect through the neck, that this exposure will also be important not just for the cancer cases that I do, but also for the benign thyroid diseases that I do. It will be very easy for me to negotiate through the neck. So my fellow surgeons who are interested to do surgical oncology, I would recommend that they should take the opportunity as it presents to them as soon as they can. Even within 2-3 years of finishing the residency training program is quite very important. So for the surgical oncology program, my recommendation is that this being a subspecialty under genosurgery, I would be interested that much of focus is within GI, so that's upper GI and colorectal, breast. Yeah, well, those are mainly that are taken up by the genosurgery, but of course head and neck. With less focus under gyna oncology, because that is in Africa is a well-specialized place for the gynecologist. My sincere gratitude to Dr. Rasha Kereji, CEO for Merck Foundation and the whole Merck Foundation office for this prestigious opportunity that I would never have had if it wasn't for Merck Foundation to sponsor me. This education is not just for me, it's for my country. So I'm very grateful for the opportunity given and the support. Thank you very much. Cheers, Malawi. Ziko mokwambiri. Thank you very much.